Well, this morning, March the 1st, marks the start of what could be a pivotal month for getting Canadians vaccinated. Millions of doses will be arriving, with the first 500,000 shots from AstraZeneca coming within days. And more regions are expanding their vaccination programs, including some of the biggest communities in the country, like Montreal and cities in the Toronto area. We're going to begin with Laura McQuillan, who has our coverage this hour. Good morning, Laura.
Good morning, Heather. Yeah, several Ontario public health units are expanding those age groups today ahead of what the province had laid out for them. And among them is the York region. So it is beginning shots for people 80 and up from today, and they can also book online. They need to do that on the York region website. They're not doing bookings by phone, and they are saying it's limited appointments, so be patient if you can't get a booking this first time around. Not just York though, Hamilton, west of Toronto, also beginning its bookings for 85 and up. They can get appointments, but that is going to be done on the phone, so they need to call their public health unit's COVID-19 hotline to book those appointments in Hamilton. And one other area we're keeping an eye on is Simcoe Muskoka, because they are back in lockdown today, but they're also beginning more bookings for those shots, opening them up to several groups, including people over 85, but also Indigenous adults 55 and up, and their household members, and adults living in chronic home care settings. Now, Ottawa is also beginning vaccinating people 80 and up in 7 high-risk neighbourhoods, and later today it will lay out how they can book. Because there is a lot of logistics that go into these things. As I mentioned, this is ahead of Ontario's timeline. It had said that by March 15th, public health units should be shifting into that 80-plus age group. That's the same date it will launch its central booking portal. But as you can see, some public health units taking such strides that they are beating that timeline, Heather.
Vaccination programs, let's look beyond Ontario, Laura. In Yukon, for example, getting back on track after some issues with the booking system. So what's happening there today?
That's right. So everyone 18 and up can now get a shot in Whitehorse with a mass vaccination clinic that launches today. 18 and up, so that's the entire territory of adults now able to get their shot, and they are hoping everyone can get them within weeks. Now, you mentioned those issues with the website, Heather. They did have some issues in the past week, falling over when so many people tried to visit it. This morning it is up. I've taken a look at it myself. There are bookings available, but that message, of course, be patient if you do have some trouble on the website. They're hoping it will stay up with so many people potentially wanting to book in from this morning. And looking at other spots in the north, in Nunavut, we are seeing as well that Iqaluit is expanding its rollout today. Everyone over 45 can start getting their shots. So ahead of the rest of the country, and they do hope that within a matter of weeks they will have at least 75% of their population vaccinated.
So a note of optimism with which to start this week, this month, Laura. Lots of discussion within pharmacy chains about how their pharmacists are ready to go. And in Alberta, that province already laying out its plans on how pharmacists will play a role. What has it decided?
Yeah, so from today, pharmacies in 3 cities are actually going to be giving out shots. This is the first place in the country to be able to do this. So that's Calgary, Edmonton and Red Deer. It's not every pharmacy. There's only about 40 from today, but they are hoping to get that up to about 100 by the end of this week and expand from there. Alberta is giving shots to anyone 75 and up at this point, so you can see they're a bit ahead of some other provinces as well. Other parts of the country do plan to enlist pharmacies as vaccination sites, but probably not until they get into the next stage of vaccinations around next month. And a couple of other notes for you, Heather. In Quebec this week, anyone aged 85 and up can go get their shot. In the island of Montreal, it's already at 80 and up. And British Columbia plans to lay out some plans for its rollout, getting into the 80-plus population. We'll get those details later today.
My word, we're going to be busy today, keeping up to date on everything. Thank you so much, Laura McQuillan. Laura began with York Region, and let's turn to that in some more detail this morning. Dr. Karim Kurji is with us this morning, the Medical Officer of Health for York Region. He's in Markham, Ontario. Dr. Kurji, thank you for being our guest this morning.
Oh, you're most welcome, Heather.
This morning, a big morning. Laura was just mentioning, we were just discussing, 2 hours from now, your region begins taking appointments for those in the community 80 years of age and over. Can you talk about the significance of this moment, first of all, getting into the general population?
Well, we are very happy to have started out with the general population. It's almost a year since we had our first presumptive case. Actually, it was yesterday. And this particular method of our immunization is a controlled way. So we are urging patients. We hope to be immunizing those over the age of 80, that is those that were born in 1941 or earlier.
Yes.
And they have to be York Region residents, and they have to access the bookings through our website, york.ca/COVID-19 vaccine. And we do know that several of them may have challenges, so we're asking them to lean on their family and friends. But we urge patients, because what we have done is we in York Region are moving as one unit with our hospitals and community partners, and we are accessing the different bookings through the website.
So just because there are concerns about people, elderly Canadians who may not be adept technologically, so there is no call center option for them in York. You're asking family, friends, someone to help them because it's the online portal, the only access point at this moment.
So that is the chief option that we prefer them to be taking. However, as they get into the website, should they require some sort of assistance, then we do have a phone number there. However, we urge them really to use the assistance of their family and friends to do the bookings.
It is not just, it's at 8 o'clock in the morning when the online portal opens up and you begin taking appointments. If all goes well, when do you actually anticipate being able to start giving shots, Dr. Kurji?
Well, some should be able to get it even in the morning and some in the afternoon.
Today?
And yes, today indeed. And we have already had two hospital clinics that have been operational, mainly for healthcare workers in the appropriate priority settings. And so they've opened up for the over 80 age group as well. But in addition to that, there is another clinic that's opening today and another one that's opening on Wednesday. And there is yet another one in the Markham area as well that will be operational. We have the capacity to bring on several other clinics in a matter of a day or two, in fact, by Wednesday, if the supply is there.
That's the question. Is it getting enough supply for the people? What are you anticipating, though? Because what we've seen in Alberta, what we've seen in Yukon is the minute that online portal opens, there's such a pent-up demand to get appointments, the system crashes. Are you expecting that could be a challenge for you in York Region?
Well, like other places, it could be a challenge for us. So this is why we are urging people to remain patient. We know that the supply seems to be pretty secure now, and we're building on that. So I believe that the supply is just going to increase. And with that, we know that we'll get to everybody in due course.
Yes. So this is today. This is York Region's portal. 2 weeks from today, when the province's system goes up online, people are going to have to switch, and your regional portal then becomes the provincial portal. What are you anticipating then? It sounds like that could be a recipe for some confusion.
So those discussions are still ongoing. It is possible that there may be a mix of options that may be available. And depending on our experiences with these different booking systems, we will see, whether the transition occurs or whether, in fact, there's some sort of mix of the options available.
Okay. I sort of ask you about the province because there has been a lot of questioning, there has been a lot of criticism of the province's rollout timetable, that they're not even ready to go, anticipating, knowing full well this would be a reality for them at some point, not ready to go until March the 15th, even with the online portal. And I'm wondering what you think of the province's pace and timetable, Dr. Kurji, because you're 2 weeks ahead of the game.
So, with any vaccine rollout, there are definitely going to be bumps. And I sympathize with the provincial folks that are putting together the systems, because they're being asked to put systems that talk to other systems like COVAX and maybe the electronic medical records as well. Remember, Ontario is half Canada's population, roughly. So it's a huge undertaking.
Has it presented, though, an additional challenge for you? Has it been a difficult partner for you? You obviously want to do the best for your residents and most expeditious response for your residents.
No, not at all. In fact, we work very closely with General Hillier, and we work very closely with the province. And we had built in contingency planning. So contingencies in case there's loss of site, loss of staff, loss of the booking systems. So we have all those contingencies already planned for.
Okay. Let me just ask, when you start giving vaccines, just to be clear, are you giving all of your doses, first dose, and anticipating that the second shot will be there in time? You're going to use all of your supply, or are you holding back the half?
No, we are using all of our supply. The key thing here is we don't want any of the vaccines sitting in our freezers. So we collectively, as a whole, have a performance measure that we're using internally at the moment, but later on will be public, which is really to see how many doses are sitting in our freezers,
to make sure they go into maximum number of arms. Before I let you go, Dr. Kurji, we're hearing from some people who are excited to know that the vaccine is getting into the general population in the Toronto area. To be clear, to get access to your shots today, do you have to be a resident of York Region? You mentioned this earlier. I just want to clarify for people.
Yes, you have to be a resident of York Region, and you have to have been born in 1941 or earlier. As time progresses and more vaccines appear, there will be consultations with the province and to open these vaccine clinics to others. But at this point in time, our allocation, per capita allocation, is by a region, and therefore it has to be those that are residents of York Region.
Dr. Karim Kurji, thank you very much. We'll be paying close attention and hope it unfolds very well for you on this first day.
You're welcome, Heather.
Thank you.
Take care.
Dr. Karim Kurji with us from Markham, Ontario.